Jane Doe was admitted to the hospital with complications of congestive heart failure and mitral valve regurgitation. This is our cardiac assessment.
Morning. Oh, let's sit you up there. It looks like you're having a bit of a hard time breathing.
Yes, I am.
That feel better? Let's put some oxygen on you, alright?
Great. Good, much better. Thank you.
Alright. I'm just going to take a minute and listen to your lungs, alright? I'll just have you take some deep breaths. Do your mouth. Alright, and let me know if you have any shortness of breath, alright? Deep breath. Do it alright? I'm just going to listen to the back side real fast. Still doing all right? Right. Here's a bit of cracking in the lower lobes of your lungs.
Okay.
Alright, now that we got you breathing better, you feeling a little bit better?
I feel
Alright, I'm just going to check your wristband. Can you tell me your name?
Jane Doe,
Alright, and your date of birth?
8480.
Perfect. Alright, so I'm just going to take a minute. We're going to listen to your heart sounds, starting with your aortic, pulmonic, then your herbs, and then tricuspid and your mitral. Alright? Alright, I'm going to go through and listen with the bell. Alright? Alright, now I'm just going to go back over with the bell and stuff. Let's go pick up lower sounds and pick up any extra heart sounds, alright?
Okay.
Alright, here's we can hear a murmur in your mitral area, which is just right here.
Okay. Come in.
Hi Jane, I'm Kenzie. I'm going to be your nurse today.
Okay.
How are you feeling?
I feel okay.
Yeah, you feeling better now that you have some oxygen on?
Yeah, it's a lot easier to breathe.
Good. Can you spell your last name for me?
DOE,
And what's your date of birth?
8480.
Perfect. So I'm just coming in to do a quick head-to-toe assessment on you, check you out and all that. I understand that in your history I saw you have congestive heart failure.
Yeah, I've been diagnosed with congestive heart failure for about 3 years now.
And have you been able to manage those symptoms pretty well?
Yeah, just okay. The other nurse said I had some crackles.
Yeah, that's very likely with congestive heart failure, especially left-sided. You kind of get that fluid in your lungs. Alright, I'm just going to start up at your head here. I'm just going to feel around. Let me know if you have any tenderness at all. Good, that all looks awesome. I'm going to take a peek in your eyes. Do you just want to stare ahead at the wall there? Good. Great, your pupils are reacting nicely to the light. They're both round. You want to look at my pen and just follow it in? Awesome. How's that nasal cannula feeling?
It feels fine.
Is it irritating you at all?
No.
It's okay. Can
Yes.
Right. It's like you have a little bit of dry irritation, but that's normal with the oxygen.
Yeah.
If you're feeling a little bit better, maybe we can take it off and give you a little break. All right. I'm going to take a peek in your ears now. Looks good, clear, no drainage. Lovely. Do you want to look at that wall? And back at this one? And can you put your chin to your chest? And look at the ceiling? Perfect. You've got nice range of motion in your neck. I'm going to take a peek in your mouth. Do you want to open up for me? Good. Looks moist, pink. Nice. And are those your real teeth?
Yes.
Very good. All right. I'm just going to check hydration status really quickly. Good. Looks like you're well hydrated. I'm going to do a little test here. My fingers are going to make a little noise. And I want you to close your eyes and tell me which side of your ear I'm on, right?
Okay.
Okay. Good. Good. Great job. Was that easy for you to hear?
Yeah.
Perfect. Okay, I'm just going to move down to your arms and check those out. Good. Skin looks pink, moist. You have strong, equal pulses. We love to see that. Just checking here to see how your blood refills in your fingers. And it looks great. All right. I'm just going to ask you a few silly questions. We have to do this. Do you know what day it is?
It is Monday.
Good. Do you know what month it is?
It's October.
Nice. And where are you right now?
I'm at St. Mark's Hospital.
Great job. Okay. Oh, I noticed you have some neck vein distension there. Just sticking out a little. Have you noticed that before?
Yeah, it doesn't go away.
It's just there. It's probably from your congestive heart failure, just another symptom of that. I'm just going to put my hands here and listen or feel for your pulse. Good. Nice. I'm just going to take a quick listen with my stethoscope and listen for any weird blood flow I can hear in there. When I ask you, can you just hold your breath? And hold. And release. And another deep breath. Hold. And release. Sure. Can you swallow for me, Jane? Was that easy for you?
Yes.
Yeah, you have no problems choking or with your food or drinking water or anything like that?
No, it's all fine.
Good. Come in.
Hi, how are you doing today?
Good, how are you?
Good. My name's Kendall. I'm the nurse that's going to be taking care of you for the rest of the day.
Okay.
Can I just see your wristband? And can you tell me your first and last name?
Jane Doe,
And your date of birth?
8480.
Perfect. Okay, so Kenzie told me that she was in the middle of doing your head-to-toe assessment. So I'm just going to continue on where she left off.
Okay.
So the first thing that I'm going to have you do is just grab my hands as hard as you can with your hands. Perfect. Good. Both equally strong. So now I'm going to have you do is I'm going to have you lay back so I can start inspecting your abdomen. I noticed that you've had some difficulty breathing. So if you start to feel like you can't breathe or you're having trouble, let me know. We can sit you back up, okay?
Okay.
All right. So I'll be lay back. Perfect. So what I'm going to do now is I'm just going to lift your shirt a little bit so I can look at your abdomen, okay?
Okay.
Okay. So your skin looks good, nice and moist and pink. Perfect. Okay, so the first thing I'm going to do is inspect your abdomen. Your skin color looks good, nice and pink, it's warm. Okay, so what I'm going to do now is I'm just going to auscultate. I'm going to listen to your bowel sounds. Get the stethoscope warm for you. Okay. Your bowel sounds are very active. When was the last time that you ate?
I ate about 6 hours ago.
Okay. Are you hungry right now?
No, I don't have much of an appetite.
Okay. When was your last bowel movement?
My last bowel movement was yesterday morning.
Is that normal for you? Pretty regular?
Yeah.
Have you noticed any changes in your bowel movements?
No, no changes.
How about in your urine? Is the color, is it different? Or?
It's all normal.
Okay, good. So now what I'm going to do is I'm just going to lightly palpate. Let me know if you feel any tenderness at all when I'm rubbing your stomach, okay?
Okay.
No pain or tenderness?
No.
Okay, so now I'm going to do now is I'm just going to go a little bit deeper. And the same thing, tell me if it hurts or if you feel any pain. Okay, no pain or tenderness?
No.
Perfect. Okay, your abdomen looks good. I'm just going to continue on with the assessment and we're going to look at your legs now.
Okay.
I noticed when I walked in that you had a little bit of edema.
Yeah, I've had that for a couple of years now.
Okay, awesome. So what we would really do is we would pull up the gown so that we could look at the skin. Your skin looks free of lesions. There's even hair growth on both extremities. What we're going to do is we're going to check your pedal pulse. Is it okay if I take off your socks?
Yes.
It's okay. Okay, so I'm just going to check both of your pulses. Your pulses are slightly diminished. That's probably due to the edema.
Yeah.
Have you been told that before?
Yeah.
Okay, so I'm just going to look at your capillary refill, so I'm going to touch your toes. The capillary refill looks good. All right, can I have you wiggle your toes for me? Perfect. Okay, so we're going to look at your edema. It seems to be about 2+. That's about 4 millimeters deep on your edema. We're just going to document that and we'll watch that to see if it's getting worse or better.
Okay.
All right, so the next thing that I'm going to have you do is I'm just going to do a little bit of range of motion and strength with you. So I'm going to put my hands on the top of your foot and I'll just have you press your feet towards you and up against my hands. Good. And now I'll have you push on my hands again. Good. And now what I'll have you do is I'm just going to have you push your thigh up against my hand. Perfect. And then the same thing on the other leg. Good. Okay, your strength is good. So now for the last range of motion that we're going to have you do, I'll have you take your toe of your right foot and run it along your calf up to your knee of your left leg. Good. And I'll have you do that on the other side. Perfect. Okay, so we've finished your head to toe assessment. The last thing that I'm going to do is I'm just going to measure the edema on your calves, just so when Jess and Kenzie come back in, we can kind of track if it's getting better or worse.
Okay.
So I'm just going to take my tape measure right here. And I'll just have you sit up first. Perfect. Okay, let's put your leg up a little. Perfect. And then I'm just going to mark where I've measured. Turn this up. Perfect. So that Jess and Ken's can measure in the same spots. Perfect. And then we'll do that on the other side as well. Perfect. And then I'll just document that in the chart. Okay, so to review, Jane Doe came in with shortness of breath that had been increasing, and when we did an assessment on her, we found that she had crackles in the bases of her lungs due to fluid backup, probably due to her congestive heart failure, and we found a mitral valve murmur, as well as when we raised her above 45 degrees, she had jugular vein distension, and we found edema in her lower extremities, which we've marked and hopefully will start to improve over the next few